Hello, everyone. My name is Hanh Nguyen. I'm Stray Animal Care Program Officer from Paws, Vietnam. Joining me is my colleague from Paws, Thailand, Chonnikarn or Paws. Paws is a stray animal care project manager in Southeast Asia. Our stray animal care project in Southeast Asia operates in 4 countries: Cambodia, Indonesia, Thailand, and Vietnam. Today, we are excited to share our presentation titled From Data to Action, Country-Specific Strategies for Stray Animal Population Management in Southeast Asia. In this presentation, we will compare population management strategies in Vietnam and Thailand, highlighting key differences and share priorities. In the next 15 minutes, we will cover our introduction, the challenges we face in each country, stakeholder identification, Paws involvement, tailored approaches, actions taken, and conclusion. Now I will hand it over to Paws to share why a data-driven approach is essential.
Hi everyone, I'm Paws, and thank you, Han, for the introduction. Let's begin with why it's important to apply data-driven and tailored strategy. To design a new relevant project and identify key stakeholders, we first need to gather data that reflect baseline situation and the size of our target populations. This information helps us understand the real context, which is essential to adapt our approach accordingly, because one size does not fit all. Now, to show how different contexts require different strategy, I will share some of the key challenges we have identified in our case study from both countries, Vietnam and Thailand. Let me start that in Thailand, stray animal management is divided between national and provincial agencies, is using different definitions and approaches. A major challenge is the lack of reliable data. Agencies don't have an accurate count of the animal population, which limit effective planning. Sterilization, vaccination, and survey are often handled by a separated body. Using different tools and systems, this results in unsynchronized effort and inconsistent data, making it hard to target the same animal groups. Most programs rely on public to bring in the animals, leaving out many stray that can't be caught, especially those most in need. Let's hear what my colleague Han is going to share in the next slide regarding challenges in Vietnam. Over to you, Han.
Thank you, Paws, for highlighting those challenges. In Vietnam, we face similar issues with managing dogs and cat population, particularly due to rabies and the dog and cat meat trade. Despite the Vietnamese government efforts to eliminate rabies, the disease still exists and has tendency to increase since 2017. Government survey data may be inaccurate, resulting in insufficient vaccine allocation. In addition, budget constraints limit rabies vaccine availabilities in some provinces. For example, in a province in the central highland of Vietnam, there are like 250,000 dogs, but the government can only provide like 10,000 doses per year. While the government focuses on vaccination, essential sterilization programs are neglected. Access to veterinary care is also limited, especially in rural areas. Another big challenge for Vietnam is the existence of the dog and cat meat trade. It poses serious health risks, spreading rabies through pet theft, transportation, and slaughter. And addressing this trade is critical for rabies elimination. While we've seen the difficulties in Thailand and Vietnam, it is essential to recognize that these challenges are interconnected. And Paws will now discuss how we can effectively identify key stakeholders to tackle these issues. Paws, over to you.
Thank you. After reviewing the challenges of both countries, it's become clear that we need strategic approaches and collaboration to address similar issues like on-roaming stray populations, rabies vaccination, and the use of data to guide program design. Community engagement is also a key element. All of these challenges require strong collaboration across multiple stakeholders. So the next step was to identify key stakeholders involved in population management, those with decision-making power, specific roles and responsibilities, and the capacity to contribute. The most important factor is a shared goal. Even though it took time to build relationship and create mutual understanding, this collaboration is crucial. We are going to cover similarity in this slide, then we will give you more detail for each specific country, including Vietnam, where Hanh is going to deep dive into more detail later. Next is, after identifying key stakeholders, Paws support partner in 4 main areas when this comes to first, collaboration and community solution. We help connect partners, find practical local approaches. Then for capacity building, we provide technical training to strengthening skills across government and NGOs. This also extends to policy advocacy. We support partners in engaging with policy processes and pushing for change. And another key element is a data and tool. We share practical tools and methods to guide data-driven planning. Our aim is to empower partners, not just to participate, but to lead human and sustainable populations management. Now, I will hand over to Hanh to share more about our approaches and collaborations.
Thanks, Paul. So in Vietnam, at the national level, we work closely with the government on health initiatives and zoonosis control. We joined the Vietnam One Health Partnership in 2023 and became a permanent partner in the Companion Animals Technical Working Group. Our advocacy efforts include a ban on dog and cat meat trade and developed effective population management strategies for dogs and cats. At provincial level, we collaborate with local authorities to enhance rabies initiatives and strengthen law enforcement against the meat trade. We assess operations to develop effective enforcement plans. And locally, we build partnerships with veterinary clinics and shelters like Paws for Compassion in Da Nang City or Vietnam Cat Welfare in Hội An City to promote responsible pet ownership through free sterilization, vaccination, and education programs. Initially, responses to these services were pretty low, but as trust grew, demand rose. Now people and their pets are in our waiting list. Next, let's look at how these strategies translate into tangible outcomes. As Paul mentioned earlier, we focus on 4 key elements which are crucial for creating sustainable change. Firstly, policy advocacy. In our technical working group for companion animals under One Health Partnership framework, we collaborate with the government and relevant stakeholders to enhance enforcement of laws concerning the dogs and cat meat trade and mobilize public support through a reporting tool which allows people to report trade-related activities. Secondly, data-driven approach. In 2022 and 2023, we partner with Hội An government, a very popular touristic city in Vietnam, on population surveys and vaccination programs, achieving a vaccination rate exceeding 90%, a significant increase compared to previous years. And from 2020, our local partners in the central Vietnam have also provided free sterilization and medical support for the local pets and strays. During 5 years, we've witnessed demand rising significantly. Thirdly, community-based solution. So we would identify key issues that concern the government. For instance, while vaccination is mandated, many families cannot afford or access rabies vaccine, leading to low rate of vaccination with some area as low as 10%. And to tackle these challenges, we support vaccine distribution and organize mobile clinics in remote areas through our partners while promoting responsible pet ownership through education programs. And last but not least, capacity building. We enhance the abilities of local partners and animal for animal rescue and rehabilitation, and offer training for local vets. In our future projects, we will focus on building capacities among local government officials for humane population management and shelter management strategies. Well, that's our experience in Vietnam, and now Paws will share her insight from Thailand. Thank you.
Thank you again. In Thailand, we focus on national level. We saw that government agencies need better practices in CNVR and population surveys. So we partner with DOD or the Department of Livestock Department and experienced NGOs to provide technical training and build capacity. This help tailor programs and support ongoing monitoring. In urban setting like Bangkok, the data show more or less similar to what Han mentioned before, that people in low-income communities struggling to access vet care. We partner with BMA, the Bangkok Metropolitan Administrations, to share data and plan future joint TNBR events. With Bangkok Cat Society, we offer free mobile clinics, build community networks, and got positive feedback and continue growing in demand. In provincial areas, like Trang province, we found high stray numbers and work with Trang municipality to improve surveys, share shelter data, and expand CNVR. We also work with Lantai Animal Welfare, who also partner with the government agency on this. They reach out to remote area and build strong community trust. People are now coming to them for help. So the next one, how this translated into action. In Thailand, once we identify stakeholder and build partnerships, Paws provides supported info key area as well. First of all, the tool and data-driven approach. We introduce tools to help partner collect accurate population data. This helps them plan and monitor CNVR more effectively based on real needs. Second one, the capacity building. We supported government-led CNVR using Paws protocols. Our team offer hands-on training in CNVR-based practices, population survey, and shelter management, ensuring partner could apply what's practical to their roles and lead future efforts. The next one is collaborations and community solutions. We help organize mobile clinic with strong community involvement, especially in urban area. In Trang, we also support shelter management and CNVR, including adoption activities. The last ones, for policy advocacy, we work with government agencies on rabies prevention and contribute to national animal welfare committees, giving us a voice to push for supportive policy and protocol changes. So let's wrap up our presentation with key point. We will continue to identify support and extend partnership in response to new policy in both countries, ensuring our approach stay relevant to each country and context. By using data, we tailor our program to reflect the real needs of both communities and animals. Looking ahead, our next step include support local partner in applying database models that fit in that specific reality, using data not just for program design, but also to guide advocacy and shape policy at a broader level. We also aim to strengthening multi-sectoral partnership to enable sustainable, scalable impact. And let's keep in mind, there's no one-size-fits-all solutions in population management. That's why we will continue applying strategy that are tailored, data-driven, and rooted in collaborations with the best interests of animal and community at the heart of everything we do. As we move forward, let's continue learning from each other and build our shared commitment to animal welfare. Thank you for your time, your dedications, and for meaningful work you do every day. We are excited to collaborate, exchange ideas, and work together towards sustainable, community-driven solutions for animal and people alike. Let's stay connected, and thank you again for your attention and to be a part of this strategic solution. Me and Han will say goodbye for now. Thank you. Bye.